So it's nighttime. I get this phone call from the hospital. They're telling me they're going to discharge my mom. And I'm thinking here, okay, how am I going to do this? I just saw her in the afternoon. She had this feeding tube. And I'm like, I don't even know what that is. I don't know how to take care of that.
One evening, I was at my office finishing up paperwork about 7 o'clock, and I had a call from my answering service. They notified me that one of the daughters of a patient of mine had contacted me and needed me to call her back.
They're bringing my mom home tomorrow, and I don't know how I'm going to handle this situation. Trying to get a hold of the doctors in the hospital. So I'm thinking, maybe Dr. Lonergan. It has been a while since my mom saw him, and I'm thinking maybe he's able to help me with this.
After I spoke to the daughter, I realized I needed some more information because she really wasn't able to provide me with enough to find out what was going on with her mom. And so I went ahead on SandlotConnect, and I was able to access her information and was able to fill in the gaps that she had presented with respiratory distress that it turned out to be due to a mass in her neck. And the mass appeared to be a recurrence of a previous cancer that she had had. And I was able to access the pulmonologist note, find out what procedures had been done and what medicines that she was on.
So I get the call from Dr. Lonergan, and I'm just very surprised because he knows what happens in the hospital. He knows what's going on with her, and he knows what's my next step. And I'm just feeling so relieved that he knows all this information. And I was kind of surprised. I didn't tell him anything. How does he know all of this?
So with that information, it made me feel much more confident that I'd be able to set up some services at her daughter's home. The family lots of times has only partial information. And so you're often, without access to a system like SandlotConnect, really making just guesses and also trying to not overpromise what you can really do.
The home health care people came to my home, set everything up. I was able to take care of my mom. My mom was feeling comfortable. I was comfortable myself taking care of her. It was perfect. And I felt so relieved.
Things would have been very different if I didn't have SandlotConnect. So the chances would be that she would have had to stay in the hospital for 1 or 2 more days in order to get these things arranged. From a healthcare standpoint too, it wasn't so much in this case, but it happens so often that you're left without enough information to provide safe care. You don't know what medicines the person's on. You don't know, what allergies, what problems they've had. And so you really take a risk if you jump in without that information.